Time is precious. Time is valued. Time is important, but it's also limited.
Make sure you take time for yourself. Watch for burnout. Balance your social life and work life.
How do I do that when I don't have enough time?
What was or is your greatest challenge in medical school? How did you cope, or how are you coping with it?
I think my first exam that I failed was my greatest challenge. I failed by 0.02% and felt so unconfident in my ability to succeed as a medical student. I cope with it by knowing I have other skills rather than exam grades that will make me a good doctor.
Is there a specific incident that has greatly influenced your mental well-being throughout your medical school?
I think dropping deciles with every passing year has made me feel inadequate and often stupid. I'm not a particularly academic medic and don't feel like I try as hard in exams as my peers. For example, people often skip meals or social events. This has sometimes made me feel like I don't belong on this course or that I'm out of my depth. Thankfully, this feeling goes when I meet patients and they tell me I'll be a great doctor. I also have to remind myself that there's so much more to being a doctor than having excellent grades at medical school. Also, I've not had to resit an exam since preclinical, and I take this as a meaning I'm better at the clinical stuff than the book stuff.
These disorders, anxiety, depression, OCD, panic disorder, PTSD, to name a few, affect 1 in 4 people in the UK, as stated by Mind, the mental health charity. As doctors, medical students, healthcare professionals, we are taught that this is important, that this statistic must be looked at, studied, remembered, so that we may remember the patients who suffer from these disorders every day. But who remembers us? Who remembers the healthcare professionals wrapped up in their job, their paperwork, their patients, their self, unable to stop, sit, and say, "Help me." A study, systematic review, meta-analysis, call it what you will, I prefer the term hard evidence, of 200 studies in 43 countries, published in the Journal of the American Medical Association at the end of 2016, shows that 1 in 10 medical students, 1 in 10, experience suicidal thoughts. Remember that.
Was there ever a point when you wanted to quit studying or practicing medicine?
All the time. It's really scary to think that I will be responsible for people's lives while currently feeling like I don't know anything and not feeling more prepared than I did in sixth form. I think about the negatives, worry about all the other things in life, starting a family, etc., and the thought of burning out. Sometimes the workload feels unmanageable and I feel like I'm going mad. It's terrifying to know my mistakes will kill, but I remember why I'm here in the first place. Also, one doctor told me it's really important to bear in mind that people die and it's not a personal failure. Patient death isn't due to my incompetence, it's a part of human life and it will happen despite what we can do as doctors.
Mental health is different. It holds different thoughts, different values, different insecurities. In some, it is the manifestation of not being pretty or smart, the feeling of being alone or unable to say, please. For medical students, it is the trauma we see in the hospital, the problems we hear, the conditions we learn about. It is the recognition of symptoms, the knowing of the unknown. It is the pressure of exams, the pressure of constant competition with those you love, hate, and fear. It is the comparison of Z values and centiles, ranks and scores. It is the absence of, hey, how are you today?
So, I got pregnant with a guy that I didn't know very well. It was a spur of the moment, one night thing, and I took the morning after pill, but these things happen. Being in the hospital, chatting to women who were sat listening to their own baby's heartbeat made me feel so sad about my own. It was scary how quickly I got attached to the tiny human forming inside me. The week of the termination and the couple of weeks after were especially tough, and I found myself randomly breaking down. 1 in 3 women have an abortion in their lifetime, and I found myself looking around on the streets, on the tube, and wondering how they got on with life while I felt perpetually broken. With time and support, it definitely gets easier, but I still think about my baby every day. I'm actually thinking about seeing a counselor because it hasn't been easy, but I have really great friends looking out for me, and the guy was super sweet too. I won't let this be the end of me.